Hi, my name is Ashley Anderson, and I chose to do my project on preeclampsia. A little bit about preeclampsia and the patho behind it. It is a hypertensive disorder, and it only occurs in 2 to 8% of pregnancies. The signs arise from soluble factors released from the placenta. Early onset and late onset. So there's early onset symptoms of preeclampsia, and then you'll get that late onset, and you can have severe features with both. So early onset is going to be early in your trimester, early in your pregnancy, and you're going to see defective placenta with spiral arteries. And late onset, it's going to pertain to interactions between normal placenta and maternal genetic predisposition. In this slide, I wanted to show a picture of what arteries look like with a healthy placenta and a preeclamptic placenta. So on the left is a placenta, is arteries that are giving blood to the placenta, and you can see that they are very dilated and they have good blood flow. And on the right, you can see how the arteries are spiraling and they're constricted and they're not getting that adequate blood flow. Symptoms of preeclampsia: high blood pressure, specifically 140/90, hypertension. Now, this may vary on patient to patient because if you already have high blood pressure, the parameters might be set a little higher if you were to get preeclampsia. You will have protein in your urine, which is proteinuria. When you go to your first trimester checkup, they will check. They will have you pee in a cup and to test your protein in your urine. Decreased levels of platelets in the blood with a referred of thrombocytopenia. The cutoff value is 100,000. An increase in liver enzymes. So that's when a patient would describe a right upper quadrant pain in their belly, and they might show you where the pain is because they might not just say right upper quadrant. This is a key factor to preeclampsia patients, and if a pregnant woman comes in the ED and says that she has that, you should automatically screen for preeclampsia. They will have severe headaches, changes in visions, blurry, seeing spots, and shortness of breath, and that nausea and vomiting will be extent. Conditions that are linked to higher risk of preeclampsia. Preeclampsia in previous pregnancies, so if you've had other pregnancies before, being pregnant with more than one babies, twins, triplets, chronic high blood pressure, like I talked about, you already have that high blood pressure. Type 1 or type 2 diabetes before pregnancy, kidney disease, autoimmune disorders like lupus, because that suppresses your immune system, and then use of IVF. So IVF it involves DNA. If you're having a donated sperm or a donated egg, your body, and you're introducing that to your body, it can alter it, and that's what causes issues. Conditions that are associated with moderate risk. So this is like you're not at high risk, you just have a low risk of getting it. First pregnancy with your current partner, obesity, family history of preeclampsia if your mom or grandma has had it, maternal age of 35 or older, below 20 years of age, and complications in your previous pregnancies put you at a higher risk of getting preeclampsia. More than 10 years since previous pregnancy. So this one is your body has changed since those 10 years, and your body basically forgets what it's like to be pregnant. So it could cause those preeclampsia symptoms. So I wanted to touch a little bit on race and how it can impact your chances of getting preeclampsia. So preeclampsia is associated with increased cardiovascular risk, and Black women tend to have a higher risk of developing it because they genetically have cardiovascular issues. There's about 60% more risk for cardiovascular disease in Black women. And knowing that Black women are at higher risk, precautions should be taken, and they should be listened to. So with all patients, I think doctors have done a really great job of raising awareness for always listening to your patient and assessing, making sure that they're well educated in all the risk and what they are at risk for. And that initial assessment is very, very important. So I think that this should include all patients but specifically, yes, Black women are at higher risk of getting it. So that first initial assessment, you want to be in there at least 20 weeks or earlier. You want a good medical history just because you want to know if you have that family history of preeclampsia or if your husband or your partner's side has that history of it. That's very important, and that goes into your medical sheet, and everyone that is taking care of you can look at that and know. Ultrasound. So you want that early ultrasound. You want to know where baby is, making sure they're in the right spot, and making sure that placenta is getting that good blood flow. So education on a timeline for a patient's pregnancy is very good. You want to educate, especially if it is their first pregnancy or if they had that big gap between pregnancies. A lot can change. So you want to kind of give them resources and always check up on them, how they're doing, what symptoms they're having. That is very good to do. And then there's this new thing, it's called test makers, to find proteins that bind with endothelial cells. And this is like a pea stick. And they are testing it out and they are trying to get it worldwide. So those people that live in rural countries that just don't have the access to good health care and good prenatal care, they can pee on this stick and it will test to see if a patient is at risk for preeclampsia. And then early on, if that test is accurate and comes back positive, then they can get them that care. They can say, hey, like, I'm going to refer you to this person, but it's out of state. Like, we'll arrange, like, we'll work with you. That is what the future looks like for testing with these. So I wanted to show what your blood vessels with a healthy placenta and a preeclampsia placenta. So the green and the yellow, as you can see, those are healthy. So in the healthy placenta, you can see they're binding well with each other and they're attaching to the blood vessels. With the preeclampsia placenta, you can see the red ones. Those are split proteins. So those split proteins, they can't bind with the other proteins. And you can tell there's more of those split proteins in the placenta. And that is what causes your symptoms of preeclampsia. And it all starts with your placenta. And then it can lead to severe features of preeclampsia. So this is the timeline I was talking about, timeline for patient with risk of preeclampsia. You have your first trimester, and that's your conception to 12 weeks or your last menstrual cycle to 12 weeks. That's when preeclampsia starts to develop. And that's why you want to get that patient in. You want to get them educated, knowing what is to come in their second trimester. Because in your second trimester, that's 13 to 27 weeks, that's when the symptoms of preeclampsia start to appear. And they wouldn't know if they're not educated on them. So, and if they're not, that's okay. You can educate them then, let them know how maybe a different delivery is gonna be, and then you have your third trimester, which is 28 to 40 weeks. And that's your last stretch of the pregnancy, and you could have an early delivery due to preeclampsia, or you could have those severe features. You could be in the hospital for the remainder couple weeks of your pregnancy. It's just good to know what to expect. And this is a QR code to my brochure. It gives a little bit information about preeclampsia, and it kind of helps make a good understanding of what is to come, what to expect, what you can take, and it gives you resources. So you can just scan that if you want to look at it or give it to someone. And then here are my resources. Thanks for listening.